Welcome to Cool Job of the Week. And this week, we're in one of the most frightening places in the world, the endodontist's office. And today we're speaking with Mr. Dustin Jones, and he's the clinical assistant for Dr. Jason Duggan.
Nice to meet you.
Welcome to the show.
All right.
All right. I'm so glad that you let us come here today and kind of invade your offices. And let's talk a little bit about what does it mean to be a clinical assistant for an endodontist, and how is that different than a regular dentist?
Well, it is a little different. It is a specialty office. We specialize in root canals and apicoectomies. It's a little different than when you go to the general dentist. At the general dentist, what you normally do is you go get cleanings, x-rays, periodontal work, things of that nature, preventative care. And when you come to us, that means you're going to a little bit different of a scenario where you're going past preventative care and you're having to get like a more major procedure like a root canal. That is a little bit different. It's a little more timely for you. It's not your standard dental visit. And when you come to us, that means that you need special care.
Now, what kind of training did you have to do for this?
With my position, I was trained on the job. I had so many hours of chairside assisting before I actually did the assisting. I watched the assistant before me for a while before I jumped right into it. After you get so many clinical hours beside the doctor in assisting in procedures, you can actually go to the state board, pay the fees, and take the test yourself.
And how many hours is that you had to do?
It's between 2,000 and 3,000 hours, I believe, the last time I checked. It's a lot of chair time assisting.
That's a lot, actually, because there's typically 40 hours in a work week, 2,040 hours in a work year. So you're actually looking at certainly more than a year's worth of time of JTA.
It is, but it is free training versus going to a dental school in that matter. You do pay when you go to a dental school versus getting the chairside time as well. And then you get to see it firsthand being beside the chair with the doctor and seeing it specifically right in your face versus just seeing it on a textbook.
I'm curious, is there anything about the job that you didn't know before you took it that you've learned that you found interesting, or maybe that you wish you would have known in the first place?
Yeah, I think the thing about the job that you have to be aware of is that the hours aren't going to be set in stone. Hours are going to fluctuate depending on what's going on in the day. Don't expect to come in at 8 o'clock and leave at 5. Depending on what we get, if we get an emergency, someone that's having pain, we will generally stay late to make sure that they're taken care of. So in a given work week, we'll put in our hours, but then the good thing is that we're not here on Fridays, so it kind of evens itself out.
You know, I walk into the office here and I'm looking around and there's all this kind of scary equipment. Was learning how to use any of this intimidating for you when you were doing your training?
At first it was a little intimidating. It's one of those things where you just sit back and watch and take it all in, and once you use it every day, this isn't a job where things change every day in terms of the equipment you use. Mm-hmm. So it's just repetitive, and you get so good at it, it just becomes second nature to you. You don't even have to think when you're doing some things. It's just you do it like you would get up and brush your teeth.
I gotta ask you, why dental assisting?
I was just in a very stressful job, working a ton of hours, and I really do like health. That was part of my degree, is health and wellness promotion, and I wanted a job change and happened to come across Dr. Duggan. Applied for the job, took it, and then the more I got involved in it, the more I did enjoy it. And you don't always see the same case every day, so there's a lot to learn. You learn a lot from seeing a doctor work like that.
I guess so. It's certainly a lot about human anatomy.
Yes, especially in the mouth. There is a lot there. You get to learn a lot of stuff that you wouldn't normally learn, and that's a cool thing.
Yeah, we got a lot going on, don't we?
We do. It is.
And now, how is it for you, just the physical part of it? Just based on my experiences of being at the dentist, and I've had the misfortune of having to have a root canal. Actually, you assisted in my root canal, but you know, just a lot of bending over and running back and forth with sharp objects. These are things that our mothers wouldn't let us do.
No, it sure wouldn't. You just got to be very careful when you do certain things, and keep in mind that there are things that can hurt you, and there are things that are contaminated. So you just got to be aware of that. And as far as the physical part of it on yourself, you can have back problems, so you want to take care of yourself outside of work, stretch, go to the gym, do things like that. There is a lot of bending over as well, just having to clean and sterilize instruments. You just have to be mindful about how you're doing things and be patient with it. At first, you're just going to be sloppy with it. You're going to want to bend over without using core muscles. But once you get all those things taken care of, it becomes tolerable and you can manage it.
And it's good advice for all of us. Take care of ourselves.
Absolutely, and the job will do itself.
Thanks, Dustin. Well, folks, there you have it. Anyone can be a dental assistant. All you have to do is pay attention, have patience, and take care of yourself. We'll see you next time. We're always interested in your opinion. You got an idea for the show? Do you know someone that's got a cool job? Do you have a cool job? Please email me as soon as you can. I need all the help I can get. Here below, Shelly at jobladyusa.com.